Radio Maria Salon, the Christian Voice. Now you host with me, Gifty Masakoi. This program they come live every Sunday, 4 to 5 Santem with Master Sabi people there at the Wel Bodi Tok place. We pray now in the name of the Father and of the Son and of the Holy Spirit. Amen. Papa God in heaven, we want to tell you thank you for the gift of life and all that you don't do for we. Within our for can't talk about Wel Bodi business. We pray for we guests them, we pray for our viewers and listeners them. That you take charge of this program and let your divine presence do it. We will make all this prayer to Christ our Lord. Amen. In the name of the Father and of the Son and of the Holy Spirit. Amen. Family them, of course, today I get 3 big alejo them where they with me at the studio. We they can't talk about speaking business. Of course, every year September na Childhood Cancer Awareness Month. From the beginning of September till to today, they don't they raise awareness at the different communities then at the hospitals them. For that we know say cancer can all picking them. And we get plenty thing for us and I today waiting at cancer. Cancer they are picking them. Waiting at the global figure. Of course, inside salon, we then at the low income country and cancer don't they affect picking them. But most of the time we don't they misdiagnose them or we don't they delay because of the thing was spiritual or so many other things or money business or they pray for going to hospital say let them not give we other sick. So for sake of that today for let we can clear that myths they or then challenges then they I get 3 people that I have for can help me. The first person a nurse educator John Asai where they na the Oladirin Children's Hospital. They all 3 then na Oladirin Children's Hospital. They transition for go na the Julius Maada Bio Pediatric Center of Excellence Hospital for picking them where they na lovely. Mr. Asai, you can tell viewers and listeners then how do.
Me na John Asari. Just as you don't say, me na nurse educator at the work from Wel Bodi business where we train people who they advocate for people who get cancer and they advocate for some hard people to come to the aid so that we are able to mend these people there.
We they talk to Soyat people them for cancer we aid for able for take care of them picking their we get cancer. And now me immediate right I get nursing officer Sia Tamba where na me group mates na what to do SCHN and we thank God for how far we don't go. We are almost 30 years into nursing. We're grateful to God and how far I don't carry with me. Thank you very much for working at the oncology department. Sia same way so na nursing officer and the same way so they work na the Oladirin Children's Hospital except the transition for go na Julius Maada Bio Pediatric Center of Excellence. Sia I can tell people there.
Family on afternoon, me and Sister Sia, as you don't rightly say, me na the nurse in charge of the oncology unit, saying the main picking up with cancer. We are now Oladirin and we also dey try for go to the new hospital along me.
That's the voice of Sia, and now we get another nursing officer na me extreme right we na Aisata Kanu we serve dinner for 1 month for this topic.
Good afternoon, family. My name is Aisata Kanu. I'm a nursing officer currently they work now oncology department na the ODCH hospital, also the transition to PC.
Alright, so we get list of things then for look into, but behind the camera we don't they talk say we get myths about cancer, and whenever you say they can't talk about cancer, you get plenty people you know one listen and they no one view and one for change that perception there because we don't get stories them where people then diagnose them very early. Then they able for buck up and able for cheer up and do so many other things. They know they die until God in time reach. And some way, unfortunately, be lost their loved ones. Them then take up the challenge and say no, because this will happen. We go do this and we go do that for other people. Then so we still they come here and talk for less Soriat people. There Soriat organizations see the need for help them picking day, and also for talk to we colleague medical people them where things say the oncology department they no need for go work there. May they no say na a place where na part of the health or Wel Bodi business where we need for work. See, I don't know if you get anything for add to this in line with team of members working in the oncology unit or someone not even know say oncology units nothing where they exist.
Well, wetin make it for say as nurses we don't pledge for work in any part of the country and our duty for say we save lives. So oncology sef na a department where we not for avoid because the pikin itself get right to Wel Bodi. So I dey encourage the company say make we no fear. Nothing no dey wey go happen to you, just like any other word. If you come to the oncology unit, you go prove am for yourself.
If you can at the oncology unit, you go prove am for yourself. The oncology unit na like any other unit wey you say ICU, you say labour ward, they all get them protocols, them on the standard operating procedures. Aisata, you get anything for add to this?
Yeah, sure. Many myths dem dey for work na the oncology unit. People dey tell you say the chemotherapy very harsh on the nurses the way every day. But as any other word, na just the preventive methods they will dey take, na in the safeguard way. So na the same as working in any other department, and we dey ask una for can join me because them pikin and we normally get the empathy for take care of them and ensure them get their well-being.
The key word here now we no more get the empathy. The parents them either no understand or they no know or wherever for start or the community members themselves. As we don't say we dey misdiagnose or we dey delay in diagnosis or we dey go in the spiritual or we dey take excuse for finances. All of these na challenges, but when you get interest as community member or when you get interest as well body workman, then you go able for give a helping hand. Of course, John Asari dey na the Well Bodi organization sef don dey for long in these activities here. Himself add im own voice.
Yeah, pikin cancer not to swear na something that can get a cure. So we for stop the pepper doctor them, especially we company nurses and health workers them, must sabi people them. If you not sabi within the treatment for give, refer the person quick to the right place where the must sabi person can give the right treatment instead of you the do pepper doctor the picking and at the end of the day you do some.
And at the end of the day you lose them. So with this said, for that we clear we miss them and also for motivate well body workman them for see the need for work na the oncology department. Now we go on no waiting na this cancer. See ya.
Okay, cancer, we get small group in our body we call the cells. Then cells dem dey na im make up we body dem. But for cancer, then cells dem dey, then dem dey grow inside like the normal cells dem wey dey grow, e dey grow with control. But for the cancer cells, dem dey grow abnormal. It means dem dey grow the right way. Dem dey continue for divide and dem no get control. And dem can grow na any part of the body wey dey cause destruction to that area there where you find itself.
So family them we all get cells and cells they get a number of numbers in our body. But where it pass mark, anything we pass mark na problem, anything we reduce na problem. So when you say cancer, you definitely see abnormal cells and they divide uncontrollably, not able for control, and the body not able for control them. So it can happen. So now when you go to the Well Bodi workman and all them go able for advice or them go able for tell you say now this they happen or now that they happen. Of course, we get types then of cancer then.
Yeah, we get boku type of pikin cancer dem, but according to the WHO, na only 6 9 we recognize here. Where the one we call am the acute lymphoblastic leukemia. That na the cancer wey dey affect the blood. E dey affect the white cells, the way they're responsible for protect the body from infection, and they get blood cells then. Then we get the one we call the Burkitt lymphoma, where the cancer it dey kind like a mass or a bump na the neck, the face, it can also be na the belly. Then we get the cancer wey we call the nephroblastoma, wey na the cancer of the kidney. We all know say the kidney na responsible for long we wet. So if that cancer dey affect that kidney dey, and pikin can get problem. It can either affect one part of the kidney or the 2 kidneys then. Then we get what we call the retinoblastoma. This na cancer, na pikin cancer wey dey affect the eye. That black thing inside the eye, na then it dey go affect and they become white. So na cancer of the eye. Then we get the cancer we call the Hodgkin lymphomas then. In now na lymph nodes them or na swelling there, it can appear in any part of the body. Then we get what we call the low grade glioma, na cancer of the brain. So the cancer of the brain, if we know dey for men now, but if you can't quick go for testing na cancer, maybe you go get way for go for further treatment. And also the cancer, when a cancer of the blood, we no care about men, but okay for direct you who say you go get treatment if you can quick and your pikin go survive.
Thank you very much, Sia. Isota, you don't hear you waiting. Sia don't say the types thing, and you don't work for some time now in the oncology department. And of course, we know say na side where they take care of picking them we get cancer. Out of them cancers they are where you don't talk. Which one that you see most common?
Well, mostly the two main common cancers that they get now the retinoblastoma and the nephroblastoma. So we get two cases there even currently with they present with them things then they end we don't manage them well right now they just there for me could they monitor them for see how well they will do before we discharges them back. And I just want to advise people then again main emphasis here now for telling for early detection. From one account early, so we able diagnose early and they get the right treatment so they need.
So now the two common than the way you don't see when are the retinoblastoma, the one for the eye, and the nephroblastoma, the one for the kidney. All other types then the bulky skin day and all, but the two most common way they don't see under. Of course, we go now to the global figures, waiting the aid-man per Wel Bodi business when at WHO. It say every year 400,000 picking them when are from 0 to 19 years, then they develop cancer. 400,000 every year, 0 to 19 years of age, then they develop cancer. And they say 9 out of 10, like we were in a salon, when are low income, they're even middle income country them, who say treatment. But put them in order, or if it dey safe, we not able for afford them. It dey ambogui. Then same way so then tell we say 80% of them picking there. When na 400,000 they affected every year, 80% of them picking there where they na the low and middle income na high income countries like Europe and America, then they well. 80% they well. Then whereas low income countries like Sierra Leone less than 30% they survive. Less than 30% they survive. So reason for them here, I don't talk in my introductory statement. Now because we dey lack for we get the things that were very expensive for diagnose, for go do test, the people dem go comot blind cam or who say no dey for lodge or thing no dey for it or for go pay for do this scan or do this or do that. As so they go along the program you go know. Then at times then they misdiagnose. Most people when they sick they go say malaria, typhoid. My all time the sick then as alone malaria, typhoid. People need go for many screen them well or maybe identify or you see some side a big panam or you see something abnormal panam say la go make them tell me wetin at the thing. They go begin go in the spiritual. So at the end of the day, if they get delayed diagnosis or if they get obstacle for let sick care because of money or because you want go seek sorcerer or because you want go for faith healing and all of them here or even lack the knowledge. Some might not even get this opportunity for make somebody talk to them. Or it don't start treatment, you don't abandon them. Or if you don't they come for treatment, but you know that they support them for they continue with this treatment here. So now for sake of that, they make the World Health Organization launch the Global Initiative for Childhood Cancer during the UN General Assembly inside September 2018. So the main activity for this initiative now for that we improve the survival of at least 60%. Because don't tell you say less than 30% of we pikin and not they survive we get this cancer, whereas in high income countries 80%, then we even less than we not even go half of that 80, they na less than 30% they survive. So we want to say in 2030 not far from now. So now make from now to 2030 then see the need say now the main target for let them prioritize childhood cancer at global, regional and national level, so that make this whole month of September na sensitization of childhood cancer. So you in a Edmana church, you in a Edmana mosque, or wherever you find yourself na your community, this na the main target, this na priority from now to 2030 for that we able for match up to that 80% survival rate through early detection or the early warning signs they will get for go through inside this program. We will now call on Mr. Asari for let it take we through the data, the one word on UGSTON, the data all over the world. We say 400,000 every year people picking the way they affected 0 to 19 years, and inside salon wey dey na low income country, less than 30% dey survive, whereas in high income country 80% and more. So let we see whose data wey we get wey available na Sierra Leone, especially from the Oladirin Children's Hospital.
So inside salon here, we get between the year 2022 and 2023, 137 pikin were referred to Oladirin Children's Hospital with suspicion of cancer. So we suspect that this 137 pikin get cancer. So after we do all the tests them, after the Sabi people do all the tests them, they confirm that 95 of these pikin get cancer. And these 95 pikin will get cancer. 46% of them were put on treatment where we aim to find a cure for these pikin them. But 43% of them were just put on palliative care. And they say palliative care, where I say treatment where we put the pikin on to minimize the pain, to reduce the pain, but we will not be able to mend the pikin. But as you not be able to mend that pikin, they left that pikin to go and suffer in pain. But you help the pikin to go through the sickness suffer, so that the sickness not the more harm. Then 11% of these pikin, their mama them, their taker them, carry them to different places where they think cancer not there. Even after the Masasabi people don't tell them that this pikin get cancer, there are some people who they say no, this not swear, this not country sick, this not so, this not that. So the 11% of these pikin, they not even accept the treatment, so they left this in the right treatment and they left. So if you look at these things, we can see that this number, that 95 children within the 2 years, and these were people who were referred with this minimal health education, with minimal awareness. This hotel say we get a lot of pikin them with the cancer they monitor them, but we not they reach them yet. So now so we did na here today, we did talk, we did advocate that all the hospital them, all the Sabi people them, if you demand pikin, and you see you give the first line treatment and the sick still persists, we are refer them to Oladirin Children's Hospital, where the consultant and the Sabi people they for them to assess, to diagnose and give the right treatment.
Wow. Thank you very much for this data from Oladirin. So we continue for thank the data collectors them and the one the way they analyze. And we know say by next year when we will be able to get updates on 2024 data, for get an improved number of patients we confirm of various kinds and almost then confirm the diagnosis, and especially the one that we can very early where they go down note the early signs and symptoms. Of course, we don't know say cancer and abnormal cells them, then they grow past mark more than how them for grow. So we want to know out of these 6 types, so say 2 na most common as salon for the beginning, how they affect the kidney and how they affect the eye. Now we really want to know wetin they cause this cancer from pikin them. Mamicia.
Well, cancer, the cause we don't know. Globally, worldwide, we don't know. But certain things in day, where we go look or call them the risk factors, where if that thing in day, it make you get a chance to let the pikin get the cancer. Number 1, where the pikin in at the womb, if you know they grow accordingly, that we not get no control over them. It can happen. If the pikin they grow properly in the belly, say they can't born them, with time that pikin they can get the chance to get the cancer. Then pikin and way the mama then get them belly, and they exposed to them, then and like something like them, X-ray, too much exposure to that can make that pikin themselves or you get more increased chance for get the cancer. Then if the pikin dey exposed to certain infections like the hepatitis B infection and C, then the Epstein-Barr virus and also the HIV virus, that again can predispose the pikin for get the cancer. Then we say heredity, it means the cancer dey na the family. If the cancer dey na the family, 10 chances to 1 dem born pikin and that same family dey, e can happen, maybe, or you go must get cancer, especially the cancer of the eye wey na the retinoblastoma. Then if the pikin dey on cancer treatment and e dey exposed to certain drugs dem after the treatment of cancer, again that pikin, some pikin ba can get the cancer, e dey reoccur again. Na what dey try for say if you expose to certain cancer drugs dem, pikin get chance to get cancer.
Wow. So humble dem, because for cancer we no know am, but risk factors dem dey, and one wey stand out, if e don dey run na your family, if you don get person wey don die or dem say dem diagnose am of so na you immediate line you get for watch yourself. Just like okay say if you get mama papa wey don suffer from hypertension, diabetes, asthma, you get for ask dem boku question or sickle cell, let you see if dem bin don ever get am and know say you possibly dey at risk for follow that line. No mean say you go get am, but you dey at risk. So na some of the thing and this wey we don highlight from the belle, say if the mama exposed to x-ray and all of them till there's some infections dem. So na dem na the possible causes for cancer, but the cause for cancer is unknown. And when you get cancer na when you get abnormal cells dem wey dem dey grow fast than how dem for go and cause problem. The two most common type for salon na the one for the eye, the retinoblastoma, and the one for the kidney, the nephroblastoma. And now we go to how we go know, because they don tell me globally say mostly people dey delayed for diagnosis or dem dey misdiagnose, and some dem by the time dem dey come na other issues dem. So how cancer dem go able for diagnose am from pikin dem wey we call the early warning signs? Aisata.
Well, the warning signs that we get for cancer is very common with most of we common illnesses then I am. So now make we dey ask una again for go for treatment and early diagnosis. We get the first sign wey na for the retinoblastoma. This black na the pikin eye, e dey get white spots, and then you go see the pikin, e dey struggle for sleep as e dey squeeze the eyes wey dey watch, and some can even lost vision sef. We can even go, some they get the way they say the eye don't come on in socket, the eye they out now, the eye they bulge out of a socket. And then they get swelling. You get swelling at the neck, na the for the boy picking at the private parts and testicles, or the gap they get na breast, they get na the belly, they get different parts them swelling them. Also, if you get picking, we get unexplained fever. For say 2 weeks, they get fever no more. You treat them also, you get that fever constantly. Pikin wey dey sweat pass smack na net. Then if you pikin the body just dey done, you don't know wetin happen. You don't try wetin the pikin body just dey done. A very pale, a weak. Pikin wey quick way for the don't boost, don't begin bleed. And then you dey get pain for the pikin, you dey get bone pain, you get joint pain, and bones they're very weak. Where if for don't quick, you don't get fracture. They say this foot don't go, the also don't go. And also we get some neurological signs them. When I make with the ask una again for pay very close attention to una pikin them, because you can see pikin don't crawl, you don't waka, and then you regress, you go back for the crawl normal, and then they waka again. So then this is na sign. Because they talk fine, it begin get problem for talk, they speech difficulties them, and they also na something for look out for. They get continuous headaches. I think it come either with vomiting or without vomiting, but constant headache. And also loss of vision. So pikin they just stop for sleep. Then they all na some of the early warning signs that we can get.
Early warning signs. People them are hope say una don listen. Where if you say if the bobo or the titi in bone then they add, then body they warm, you know they feel for it. If you say na malaria, you don't treat malaria, malaria nay well, you don't treat typhoid, typhoid nay well, they don't go gigi and drip there, you don't go buy medicine there. You still see say no improvement, go with the pikin na pikin hospital. Either all are doing or you go na Lumley hospital, make them see the pikin, make them do so many tests and rule out wetin na the problem. If pikin tell you say they get problem for C, not take and light, go with an aside savers or wherever when they check your eye, let them able for give the advice. Now with all these early warning signs, we don know say na abnormal cells don go pass mark, e don go fast fast, then we don see say the cause not known, but get people dem wey dey at risk, and thing dem dey wey dey do go make the pikin dey at risk for get these issues there. Dem don know wetin na the warning signs, early warning signs wey go able for make the outcome of the treatment wey dem go give this pikin no be the palliative as Mr. Asari be say not for easing pain no more na for let that pikin get cure and carry out im activities of daily living. Of course, test dem the way dem go do. You no go normal you say e don get fever for 2 weeks, im body don hard, or wait for don e dey bruise. All dem early signs dem dey wey Aisata don name. Test dem dey wey dem can do. E involve cost, e involve money. Wey na that dey make we appreciate the partners dem wey don dey help dem for look after dem pikin there. So wey most of dem the parents dem no get for let dem able for do this. So now we go ask Mr. Asagi for name wetin na dem test there wey dem can do for dem pikin there for long na confirm say yes na cancer, but this particular cancer na the one na the kidney, this na the one na the eye or whatever, and who side dem can go for do dem test there.
So if the pikin get these early warning signs and you for refer am to Alabi Children's Hospital, the master sabi person dey assess the pikin first. After assessing the pikin, e for take blood from the pikin in body and return the blood to the lab wey boku test can be done within the blood. After the blood, we can also take the pikin to a scan, either a CT scan, ultrasound scan, or X-ray. All these scans also help to detect the exact kind of sickness or exact sick that can affect that pikin. And some time back, you can take something we call biopsy. We can do something we call biopsy, where a portion of the pikin in body can be taken to take to the pathological lab for them to assess them to see where the cell they grow, whether the cell they grow normal or they grow past mark. So if they grow normal, that means the child not get a cancer, but if they grow past mark with some features them, then it guide the masabi person which cancer that pikin don't get and which medicine they for give that pikin.
Family them and all the investigations there, whether the blood test, the X-rays, the ultrasound or the CT scan or the MRI, whether they go do take picture of the pikin, the part where get the problem, or whether they take that live cell for go do test. All the investigations they're available inside Freetown. Now we go one know, since we don't know the early warning signs, since people then can misdiagnose, since people then they come and it can be delayed for let them diagnose because then they come very late. And we don't know the early warning signs. So if somebody know this early warning sign that he get unexplained fever 2 weeks ago in body they want more the pikin for the boost, or easily don't wound, or in bone this, or you not feel well, or this that, all them points away isotado is, then this pikin come very early. Don't do all them tests there. So when Mr. Asagi don't line out. If he confirm say the pikin get cancer, the cancer go be cured?
Well, it depends. If dem come earlier, because we get cancer by stages. If they come at the low stage, where you say the stage 1, we can able for treat am. And the treatment na free. All the tests that we don't outline so they available, you know they pay nothing for them. So then they put there today for tell you say, come with the pikin quick, so that we go for see am and treat am, and the pikin will well.
Come with am and treat am and the pikin go well. Isota, I want let you go over the early warning signs. Let people really know the early warning signs. You will say, all tell me pikin body they want, me pikin body they fine, me pikin no they eat, if for don't know more, then signs and let we go over them again. And then people know say not to miss, not to witch, not to all them here don't say where we get so many things them go with them. Take note of any of them here. We'll not go say na in, but go make the rule out. Then you mind clear say no to this. Let tomorrow that pikin not grow up. they end up for blame you as mama and papa wey put her into that excruciating pain. Okay, Sia.
Well, according to wetin my sister bin don talk about the early warning signs, e no mean say when you see dem here the kind of my sister dey say the pikin get cancer o. No, because other sick dem dey wey fever like this. But if you calm with am, we go for assess the pikin and know if na him. We go tell you if the pikin im eye, you see im eye get white thing, e dey shine like pulse. How you go know? If you snap the pikin with camera, you go see instead of the eye red na white you dey see dey. We dey also call am the pulse eye. Sunday kind the pikin eye dey bend like cross eye dey stray for see. You know, e dey double in step there wey dey waka, e dey make e wan fall down. Bring that pikin dey. Sunday if you see any swelling for the pikin, e dey na im belle, the swelling look strong, you know. E dey na im head, na im neck, na im leg, you know. If na man, na im private part, woman na im private part, or you get dem na im groin na ya. Yeah. Or some say na gbongbonyoko, say e dey na im neck na ya. No, carry the pikin. Not say na witch. Sunday if you see pikin belle big, it snap and I say, oh, this pikin na witch. E don go give am im mama im belle, im papa im belle. Not a witch. Carry the pikin because it can normally sometimes can be say na sign of cancer. Then the pikin like enough for down. They see number boost. They boost fast. That pikin they we need for see am. Let me assess am. Then the see number bleeding just burst by the pikin. You know the bleeding they control. Bring that pikin na other sign than dey. Then the pikin dey get fever. The kind of my sister don say you don treat for malaria, typhoid, you don treat for infection, you don see say the pikin dey fever no dey gree go. E don dey take 2 weeks. That pikin dey for bring am come to me. Let me assess am. Then you see the pikin bin dey waka fine. That's not do am o. The pikin make like say im foot dey hard. You know, e dey complain im foot say like im bone dem. If that pikin dem go test am, no go sickle cell at all. That pikin dey uba for see am because sometimes na the sign of cancer dey dey. Then the pikin see bin dey talk. Then now when dey talk na tell like say im tongue dey tight, dey talk clear. That again na other sign of cancer wey we feel say if you bring am calm, you get able to see. Then the pikin, you know, e be so lively, you know, e dey pass. Then now e dey weak no more. Now you see the pikin, e go see na corner, e weak no more to himself. That again na other sign. Or you see the pikin, im body just dey white. I like when e eat fine food o, im body just dey white like e no get blood. Or if you don come admit na hospital, you no get am blood, one thing you go come back the same month, blood dey get am fast. Bring that pikin dey because it can be sign of cancer. Then you see the pikin again, you know, e dey complain back pain, bone pain, you know. Then pick e follow im foot, then you don scrap, you don get broke foot. That pikin dey back, bring am come to me. We go for tell you wetin the pikin dey go through. Then the pikin na net e dey sweat no more, e dey sweat, e dey cough, and you don go test, the pikin no get that what we call dry cough. E no get at all, but e still dey continue for the sweat na net. That pikin dey back na other sign of cancer like the way e happen to pikin dem. Then the pikin with all the food e dey get, e dey eat fine, e just dey dry no more. E dey dry fast, im body just dey done. Maybe you don come see the doctor, you don look am say the pikin no too malnutrition e get. And e continue for dey dry, no, im body dey dry. That again na other sign of cancer. So I will stop here.
That again another sign of cancer. Family remember say this na Childhood Cancer Awareness Month, and with me today I get nurse educator John Asari, and I get nursing officer Siatamba and nursing officer Aisata Kanu wey dem comot na the Oladirin Children's Hospital, and so dey na the JMB Pediatric Center of Excellence. Dem don dey work na the oncology department, and then passion na for dey with pikin dem wey get cancer. And we dey na today for promote early detection, because when you detect am early wey dey na the low stage of the disease, yes, most of them cancers dem curable. Now the treatments dey in 3 ways. You get medication, you get surgery, and you go do therapy. So how una can go about Aisata, I don't know if you want start, then say I take am.
Yeah, sure. So where pikin can just come, where after we don't do all the tests, then we don't confirm say na cancer actually get, and we don't confirm the type of cancer we get. Then we get certain medications that we can put them on, or they say chemotherapy, they go through chemotherapy. And for the surgery, now for the one the way we see say we dey able to go remove the organ beside the cancer they before it spread to other areas in the body, and also the same with the radiotherapy. So for more able to be successful in the treatment, we get large team where they work together. We get the doctors there, we get the nurses there, we get lab technicians there, we get surgeons, and we get so many people there where they work all for make we able to be successful in the treatment.
Yes, yeah.
Well, like how my sister don say, we no dey just scan no more just follow up and the pikin. If you don do the test, e don show say na cancer the pikin get, then we dey begin the treatment. We dey start with medicine wey dey give the pikin, what we call chemotherapy. Wetin that dey for? Because most cancer dem like dey one side, or some cancer kin don spread other side. But if the cancer dey one side, we dey try for give am medicine so that we go for make the cancer, if that swelling dey, e go down. And if e go down, then we go send the pikin, dem go do an operation. But not all the cancers dem dey do an operation o. But the one dem most okay do operation pan the cancer of the eye, wey na dey get retinoblastoma. If the one eye don ambog and the pikin dey see with the other eye, we want target am for the pikin no get the other eye back get problem. One make that one eye wey don get the problem, now we dey try for treat. If we don treat am, we don give am the medicine, with time the pikin get for go for operation, so that dem go see how we go for treat that side so the cancer no go na the other eye. Then if the pikin get cancer of the kidney, wey na the nephroblastoma, we dey try for give the medicine because dem can belle dem swell like 9 month belle woman, and the pikin most of dem no kin get fine body or fine energy for go for operation. So we dey treat them with the chemotherapy, whilst we dey allow the nutritionist na dey for food business give the pikin fine food for build am up. After that, we can send the pikin for operation so that dem go pull the side wey get the cancer. One thing for cancer, any side cancer dey, that side dey, dem for remove am. So na that we dey do so that the other part no go dey affected.
Remember, say they get we live now with 90.9 studios and Freetown 101.3 na Makeni, 91.7 na Boy, 90.7 na Kenema. The same way, so okay, add the voice to the program na 079900907 or 077315147. Today we dey look at childhood cancer, and this na the month for raise awareness. Mr. Asayi, you don hear wetin Sia and Aisata don say. So successful treatment require multidisciplinary team. Aisata don name some of the team members, and so other normally na the team members wey una dey work with, and how the relationship don dey for make una work easy.
So as Aisata don say, we get boku team people there. The pikin who get cancer and the mama whom pikin get cancer, or the comrade whom pikin don get cancer, you know they left am alone. We get counselor or family support officer where they give them some kind of counseling to explain things to them, the treatment option, whether the person they go for surgery, they give chemotherapy, whichever we they do, before explain to them, for them to understand what they happen and what we for do, so that we for journey with them. Then we also get just they say the nutrition, the nutritional, the surgeons, the pathologists, all the team members there. But in spite of all these team members there, we also get other hard people who can come to the aid to help me to get some kind support, where we able to pay for the medicine then, where we be able to pay for the nutrition, the food that the pikin they eat, where they dey in a hospital, where they can also be able to pay for the scan and the X-ray and the hospital, the UMC, the Saroda with our surgeries there. We get the Ramsey lab, and we get a Connaught hospital to see the way forward to mend the pikin. And all these things, we are able to mend them only when they come on the treatment. We say all radiotherapy, but if the pikin come quick, or if the comrade they bring the pikin quick, we'll be able, the pikin will be able to mend the pikin, sometimes just with the chemotherapy. But if it goes it takes before they bring the pikin, that means there may be a need. So it will be an avenue where we dey put that pikin on the palliative, or we dey beg, and if we not get, so we have people to send this pikin out for the treatment, that means that will be the end of the pikin's life, where we put that pikin on the palliative care to help the pikin to deal with the pain without being suffering too much. So all this we dey beg or we dey advocate that when we see we will be able to do the needful for the pikin.
Early warning as possible. Of course, pikin dey get cancer, and when pikin get cancer, one question wey people go ask na that, is it that im
And just because one is na school, then they a very online are free, no cost to you.
please una come early. Of course, we dey try for them we prevent, and if you don get the early warning signs, we dey come for them we promote you well body one, try for stabilize, let you return back to normal. If na your eye problem or na kidney or whatever type of cancer wey dem detect early, for let dem able for intervene with all the sorry health organizations there, so wey don be named, wey dey get their own role for play, the nutritionist, the pathologist, and all of them one day. But yet we still dey try. You wey go say, hey, I wan marry or I wan this, is either I go know or I go this, as dem can say for that. So we go wan know if cancer can be prevented in pikin dem.
Prevention of to prevent pikin cancer is something that we not for say yes or no, but all sickness, we for take good care of yourself. The pikin get fever, as my sister they say talk about the early warning signs there. Any sick that pikin get, if you take that pikin to the hospital quick, in a way is also in the way of a prevention, so that if the right treatment is given to that pikin at the
unknown, but you get all the early warning signs wey we don give, confirm say no or yes, and then if na yes, then dem go do early for say. And of course, Mr. Asari don name some of the services dem wey be available for this childhood cancer. We still dey continue for talk to viewers and listeners dem for give a helping hand, and at the end of the program we go announce numbers dem. You wey feel say na your birthday, maybe you get a round figure birthday, 40th birthday, 50th birthday, or 25 years na maridos, or whatever you want to appreciate God, you can give a helping hand to these people dem, or this Oriat side, show empathy, so then kind picking there, so and save a life, so God go bless you. Remember, God loves a cheerful giver. Yes, yeah, you can work more on the services them we available for this childhood cancer.
Yeah, as the brother already say, we get services them, but not all we able for do. Like for do the imaging, they scan them, the X-rays them. We get people that way they help for do that, and if you buy the medicine, but you don't do. Even try to hospital, they give you discounts. The UMCI hospital, instead of create people and surgery, cannot the pediatric ward, care people for doing picking and surgery, Ramsey also in the give discount. But we still advocate that if you see and say in need for help them care, because it's not easy for them at all. Most of them they come up upline and they can't at the hospital for so long a time, feeding other things and other people they help from other country. Then go stop one day. Let we help we self, let we help them care for survive. Whatever thing you get, not small, and God will surely bless you. Me, I believe saying I had forgive. Then I pick it and find for help, and God will surely bless you.
And God will surely bless you. And now this they take we to the challenges them amidst all of what we don't say. Now abnormal growth, and you get early warning signs. You not get cause, but you get risk factors. And within a low income countries, and within below 30% for letting picking they are survive because of delayed diagnosis or misdiagnosis and all others it takes, and financial constraints or with spiritual background, we wan believe in faith healing rather than for go do all it takes first and confirm all other things. Then we get faced with them challenges here, either at the Well Bodi workplace or faced with the challenges with the parents and so many other factors, or even community members them. Now we go listen to Mr. Asari for name some of them challenges they are wey they don dey encounter.
So as we start the men pikin wey get cancer, there are boku challenge dem wey we dey face. Though we don say we get some hard people who dey help we with the medication, with the scan, and with all those things, but still we dey look at the cost, the high cost of the treatment and the high cost of diagnosis. So sometimes there's a hard person they give you for 3 people, 7 people. So within the budget for you, they reach. Again, we not get a radiotherapy in this country. So if the pikin delay, or if they delay before they bring the pikin, it becomes some kind difficult for men the pikin. Again, we get the cannot work too well our surgeries, and we get the pediatric surgeon, but not all the surgeries that can be done within the country. So this back is another constraint or another challenge where some of the cancer then will not be able to. Then we come to as this family and the pikin they come up from upline. The side where we dey mend them in the hospital, the side not big. So we for still the advocate if we can get some kind of accommodation where we these people who come up from upline can stay yonder and come to the hospital and take their treatment. Because sometimes initially when we dey do the ward, we dey think that time we thought say na 3 pikin wey we get. So we say let make the ward 10 bed capacity, because we dey get just 3 pikin in our ward at that time. But sometimes now we can get 13, 16, 17 pikin within a period of time. So 17 people not go be in a place where we dey made for 10 people. So we dey ask if we can get accommodation close to the hospital, or any sort of hard person can give me his accommodation where we can keep for the pikin and their mama. Then when they come for treatment, they can rest there and they come to the hospital for the treatment. We also say we not get some of the diagnosis, some of the advanced diagnostic investigations cannot be done within the country. So at times it becomes so difficult for us to actually get the exact diagnosis when they get to that stage. And sometimes, though we dey thank the numerous donors who they come help you to get blood donation, like the Lifeline, the Hemia, Lulu Foundation, and the workers at the Oladuni Children's Hospital. They can help you to get some blood when we need them. But sometimes these pikin wey come up from upland, the mama or the papa who come with the pikin, sometimes this mama or the papa say not get boku blood and the pikin need blood, and we not get it. We sabi that blood is not something that we can buy from the store. So even if they get money and you need blood, you still take the person who gets sorry heart come to your aid. So we dey advocate that anything where with society or association, with Thanksgiving or whatever, we can also think of organizing blood donation and come to the Oladuni Children's Hospital Blood Bank. We donate yonder, and this blood can also be used for these pikin who get cancer. So these are some of the challenges.
These are some of the challenges. See, more challenge there.
Iboku is not to the patient in your side,
Okay.
But even to the nurses in your side. But come on, they say for treat pikin dem with cancer na pass you specialize in what I mean na certain people no fit for do am. So but come no dey even one for Canada unit dey, and who dey work in dey stigmatize we, dey say all sorts of bad thing dey against the nurses dey under, say if you dey there you no go this you no go that, all that no true. I wan make you know say dem pikin still get right for live, and even the parents if dem come, just imagine you can't say pikin get cancer, somebody dey deny, he say no you no get cancer, e dey go force, and that go wey dey go maybe you no come early, you no come see am early, e dey deny, e go force, say dey come, the cancer don go na other part there. Somebody even say no, im pikin no to hospital sick, na which you know which im pikin na country sick, na im mate don do am, na im step mama, all dem challenges dem dey get am. For like if someone even sign the form for start dem for give pikin medicine, e can take we boku talk, e no easy. Cancer treatment, the one whole world, e no cheap, e very expensive. Every drug, everything they use for treat cancer, very expensive. And also we sef we expose to them drugs a day, but because we take precaution, we able to take care of them pikin. The challenge is so much because even they don't know them, they can't remember what I say. Also for everybody in the game. Even though now we don't get other 10 beds na the new hospital na normally, we thank God for this government we don't bill for we, e not still do, because the more they can do the awareness, patient they come, and when they come, the mama and papa no get side for lodge, so we dey advocate, we dey beg, if you get place forgive me, we go appreciate am. And when they come, they go for the day, and they comot the cancer and pikin and medicine dem. You know?
Thank you, Sia. Yes, Aisata, any more challenge or any recommendation?
Yes, just for add, as Mr. John said, for the high cost of treatment and diagnosis, we dey plead with people, then please, any assistance we able to offer, any small thing when you get, they not too small for you, we can greatly appreciate that. And again, Mr. John, we talk about the specialties they will get, say most not available. Like for the low-grade glioma, we sister talk about, when are the brain cancer, we'll not get any surgeon at salon with it treat that. So if we can get that, either we send them overseas if we will get donors then for sponsor, or we put them on the palliative care. So we again we ask for even that, so we will get people who will sponsor them things then they for we, because at the end of the day we aim now for cure the cancer, not for put to patients on the palliative care within there. And also for add to the accommodation, we need people who will be able just for support we financially, for giving place so many people they stay, because most of them they come on at the villages that they cannot some, they're not get anybody now, they don't know any place now yeah, and can't admit, and they're very crowded at the hospital day, the bathrooms them and most of the other challenges that we face in the world. So we need place for maybe they will accommodate the relatives that we carry them picking in day. And also for the blood. Mr. John again as you say that then something back with very important. So we get it in the way they kind with leukemia, when a cancer of the blood, and they need blood supply because they lost blood very fast. Most times when they get right for blood, then they get at that point in time. You go to blood bank and they tell you you're not available now, personal wait, say somebody can donate, or organizations then try for family for certain the health. So that's back now, so they plead on for people and they help with blood donations.
Yes.
With blood donations, it plenty. So family, as I say earlier on, if you get any special activity where they celebrate, you want to tell God thank you, remember the one there at the cancer ward, and see how you go visit them. I think visitation also key, emotional support key, because those parents abandoning the other picking them for kind of hospital with one picking, you know what it mean already. No, okay, because you abandon all others in businesses where they do or in work where they do just for kind of with that one picking a hospital, and possibly don't carry it and then delay for diagnosis. So at the end of the day, the outcome also can be challenging. Or you then at the ward, they see another picking die, or don't kind of thing, and they waiting mean for them, or even the nurses them. So that thank you, that tapping them at them back, or say yes I did there, or you say yes I care, or say yes I appreciate you. I think that they go a long way. So emotional support is very very key. So they call on the organizations them as well where na experts for counsel for men, and they go na them places and they just as they can pay attention to the prisons and all. that place then they serve need people for the visit them. And as time dey catch you, we can announce the number if you want ask more questions, you want more clarifications, you know able for go na Oladurin, or you know able for go na the pediatric center of excellence. You can call on their numbers there 073 001 064 or 033 966 093. If you call their numbers there, they will answer your question where sometimes you want clarify more for the early signs and all other questions, or for do test, or whether you want support to speak, you want for help, or whose mama or family want help in your own way, or you want for be somebody where they help for donate blood, all now they can help for save life. So quickly as we round up, you can give the activities what we get for this week for the we go wrap up the program.
So this week, as we do the awareness month on the 26th, which is a Thursday, we have survival meeting where all the some of the picking them we survive the treatment. We meet them with our stakeholders to show them as testimony for the advocacy that we do. Again, we do community engagement within the western and within the western area, both rural and urban. So a team will be seen sometime at the market square or at the Lolly Park, giving some kind health talk and awareness. Also, we do blood donation. So with the blood donation is open, and we are not giving day and time now. It's open every day, every time. You can call the number as Sister Gifting don't call out. You come, we lead you to the blood bank, we guide you for you to donate to help with men these people who get cancer. Because blood transfusion is part of their treatment. Some of the picking them, when they on the chemo, they can monitor their blood small, so sometimes they have to get transfusion before they can continue. So these are some of the activities, and they also go to the churches and the mosques them, and you can hear us also on other radios and the TV stations. So wherever you hear us, they advocate for these pikin who get cancer, and we also they plead with the people them come to aid. They sort of people them come to these pikin them aid, so that you help them. Your these pikin with the men, they might be future leaders them. They can be with doctor them, be honorable members them, with president, with nurses, with teachers, with pastors, with imam, whichever leader you can think of. So before come to be aid, let us help these pikin, let men them, and we get the future leaders for yourself. Thank you.
That's the voice of John Asai, nurse educator. We come out now Wel Bodi partnership and same so they na the Oladurin Children's Hospital, and also the gain support na the oncology department. Nursing officers here Tamba will gain that message now.
Family them before I left una, and they plead on again. As you don't see all next sign on also, not delay with the picking, carry it on. Because we say early detection, they save life. So when this are the left with you, watch it begin, examine her every day for see. If you see any changes, we're not satisfied, meet we and we will for talk to you.
Yes, Aisata.
Again, just as Sister Sia, they say prevention better than cure. Please come early, come with you begin. Make sure say as soon as you see any of them signs that you can do the testing for you now free of charge, no cost to you. So please una bring una picking them again to the donors there, as so they plead for support financially and any other way una able support we go really appreciate that.
Early detection are key. Cancer not get caused but get risk factors, and they don't name all the signs them. So if you get more questions, you want for give support, you want for clarify so many things, or you don't identify picking at your community, or you're not teacher in a school, you don't identify picking with some of them problems there, you can call the parents them. And you want more clarifications, you go reach out on 073 001 064 or 033 966 093. With me today, I say I get John Asari, nurse educator, Siatamba, nursing officer, and Aisha Sakano, nursing officer, where they all come out the Oladoyin Children's Hospital and JMB Pediatric Center of Excellence. Transition into that hospital and same way so they at the oncology department. So I want to appreciate Una and tell Una plenty thank you for the sacrifices, and I hope say this could be eye opener to other healthcare workers and for seeing the need for partner for Gogo and Soyat organizations them for hidden help. So the technical team, I want to tell Una thank you, and we left Una all now in the name of the Father and of the Son and of